60 million people in the US population suffer from allergies. That's enough people to classify allergy as an epidemic, but most of the people who have allergies are never actually diagnosed. Some people don't even recognize the symptoms: runny nose, coughing, headaches, loss of taste or smell, difficulty concentrating, or sleep disturbances. However, most people do know that something is interfering with their daily activities. Allergies happen when your body's immune system reacts to substances that wouldn't cause a reaction in most people. The immune system's function is to help your body fight intruders such as parasites, bacteria, or viruses. If you're allergic, your immune system reacts towards natural substances the same way it would react towards something harmful. Your immune system misreads something that is otherwise completely harmless. The top 8 sources that cause allergic reactions are grasses, house dust mites, ragweed, birch, cat, dog, food, and venom. On average, most people are allergic to 2 or 3 sources. There are 4 types of allergies: respiratory allergy, skin-related allergy, food allergy, and insect allergy. Respiratory allergies are the most common allergies. Symptoms include sneezing, itchy and watery eyes and nose, and wheezing. Hay fever, also known as rhinitis, and/or asthma, are the most common ways for respiratory allergies to manifest themselves. The respiratory system is usually affected if you're allergic to tree pollen, grass pollen, animals, molds, and house dust mites. Eczema, also called contact allergy or contact dermatitis, is the term used for an overreaction of the skin caused by direct contact with certain substances, allergens, in our environment. It can either be allergic or non-allergic in nature. The 2 reactions often look the same. The only way to distinguish between the 2 is to perform an allergy test. Eczema, diarrhea, nausea, swelling of the throat, hypotension, and in worse cases, anaphylaxis, are all signs of a food allergy. Signs of an anaphylactic reaction can include difficulty breathing, wheezing, chest tightness, nausea, or dizziness. Medical attention should be sought immediately. The most common foods that cause allergies are cow's milk, egg proteins, soy, peanuts, and fish. Allergy to insect stings occurs as a severe local skin reaction: exhaustion, dizziness, swelling of the throat, and in worse cases, anaphylaxis. Yes, studies have shown that children who suffer from hay fever are more likely to develop asthma. Allergic rhinitis and asthma are part of the same condition that can coexist in up to 80% of patients. This means that by treating the cause of your allergies, you may prevent the progression of allergies to asthma or reduce asthma attacks. There are a number of treatment options available that may offer some relief from allergy symptoms. These options include avoidance, prescription and over-the-counter medications, and allergy immunotherapy, also known as allergy shots. To help determine whether an allergy is involved, the doctor may perform a skin test and/or a blood test. A skin test involves either a gentle prick with a drop of allergen extract on the surface of your arm or an injection of a small amount of the allergen extract into the skin. This method may result in mild swelling and a reddening of the skin, which tells the doctor that you have an allergy. For most patients, this method requires about 1 hour and is not very painful. A blood test can be used on its own to confirm skin test results. If specific antibodies towards one or more allergens are found in the blood, it means that you are allergic and would have an allergic reaction if exposed to those substances. Several kinds of medication may relieve or prevent your allergic symptoms, such as pills or sprays. Another kind of treatment is allergy shots. According to the World Health Organization, allergy shots is the only treatment that treats the cause of your allergy instead of just the symptoms.
My name is Marin Labrador, and my son has a lot of allergies. He's allergic to foods, environmental stuff, and he has eczema. He is on the shot treatment, so that has really helped because he's allergic to trees and grass and so many things that are just everywhere. You know, he'd be a bubble boy basically if, so the shots have really helped in that area, and keeping him away from the foods. He now understands just about everything and can speak so much better. And people who see him now are like, what a dramatic change. Now, since he's been on the allergy treatment, he can go outside for longer periods of time to play outside. Before he'd go play outside, and within 2 minutes he was running back inside because he just couldn't stand to be out there. He couldn't be around animals at all. Now, he still can't touch them, but at least he can be in the same room with a dog or a cat, or So his quality of life has definitely improved. His speech has improved tremendously. His receptive understanding is it's incredible how much now he understands, and you say things and he just picks up on it. And he still does have days when his allergies are just really bad, and you can tell the difference because he'll look at you like, I don't understand what you're saying. But for the most part, you can, he's understanding just about everything. At least for my son, he knows, he asks to go get the shots. And and people are amazed, like no kids, he's only 4. When he started, he was 3, and he would get mad with us if we didn't take him, because when he started, it was 2 times a week. And the other days that he didn't go, he would get mad because he wanted to go. And he still likes to go get the shot treatment. And he asks for his medication. And he won't eat any of the things that he now knows that he's allergic to, because once he takes it in, it's like his body just rejects it. So my advice is, you don't feel what they're feeling, but they could really benefit from it.
Allergy immunotherapy, also known as allergy shots, is a clinically documented treatment that considerably reduces or completely removes your allergy symptoms and the need for traditional symptom-relieving medication. Until your immune system has had time to adjust, you may still need the medication you are already using. After 3 to 6 months, your need for drugs may decrease and your symptoms may become less severe. An additional effect of allergy shots is that it may prevent the onset of other allergies and the development of asthma. Studies have shown that children who were at an increased risk of developing asthma were able to resist the onset of asthma and see their existing allergic symptoms decrease after completing treatment. Also, the treatment has a long-standing effect after it is discontinued. New scientific studies have shown that results are maintained for 5 to 10 years after the course of allergy shots has been completed. Among the wide variety of treatment possibilities available today, allergy immunotherapy, allergy shots, is the only treatment that targets the cause of allergy and alters the natural course of the disease, which, for many patients, may lead to an improved quality of life. An end to discomfort and feeling ill, consuming less symptomatic drugs in the case of respiratory allergies, freedom playing soccer, golf, or tennis during allergy season, fewer problems having pets at home or seeing people with pets, the elimination of the constant fear of being stung in the case of insect allergy.
My name is Brian Lawson, and I'm taking allergy shots. I'm currently taking 1 allergy shot a week currently, and it's no problem. It doesn't hurt, doesn't do anything, and just feel a lot better. Well, before allergy shots, I was suffering from 4 to 5, sinus infections a year. Now, I've not had a sinus infection since I've started the allergy shots, and I don't have near as much stuffiness, headaches, getting a lot better sleep. I'm just outdoors a lot more. I don't have to deal with all the buying of the over-the-counter medication anymore. I don't have to, no more visits to the doctor as far as going and getting antibiotics, and just a lot more days feeling better. We go camping. We enjoy camping more. We don't have to take the big medicine cabinet with us anymore for all the allergy medicine and stuff, so it's just made being outdoor more enjoyable. Allergy shots will help you if you get checked out, and they'll help you, yes, definitely get it done, because it'll make you feel a lot better, a lot less sick days.
During the treatment, the immune system is gradually desensitized through injections of small doses of specific allergenic proteins extracted from natural allergen sources, pollens like grasses, trees, etc., house dust mites, animals, insects, and more. You eventually grow accustomed to the allergens that normally caused an allergic reaction.
Hi, my name is Sandra Curry, and this is my daughter Sherelle Curry, and we're going to be talking about her allergies and the allergy shots that she has taken and the results that we've had from her. She was on allergy eye drops, Zyrtec. We were taking that daily. Started the shots, and she's not having to take any eye drops any longer or the Zyrtec. The shots are working great. She's wearing her contacts. She's very happy. I'm very pleased with all of the results that we have gotten from the allergy shots. Very pleased.
Hey, hi, I'm Sherelle. I used to have allergies real bad. My eyes were real puffy and red and itchy, and my nose was real stuffy, and my throat was always sore, and I didn't get to go outside a lot. So then I started taking the allergy shots. And everything's clear now. I get to wear my contacts, and I get to go outside whenever I want to. And I get to do a lot more now that I'm taking the shots, and they don't hurt. I thought that they were going to hurt whenever I first started taking them, but they don't.
We are just all for the shots. I mean, it has worked for our family tremendously. It's changed our lives a lot. Like I said, we've not had to go to the doctors. We've not had to take all the medicine. It's the ideal thing for anyone that has allergies. I mean, it's like a dream come true for me. Saved money, saved me time, saved me headaches and heartaches with my daughter and all of her itchy eyes. So it's been perfect. I recommend it to anyone.
Allergy shots are used for people with respiratory allergies caused by tree pollen, grass pollen, animal dander, molds, and house dust mites. It is also very effective protection against allergic reactions to insect stings.
My name is Jennifer Kale. This is my daughter, Catherine Kale. And she's used to have eczema really bad. Probably like a month after she was born, we discovered she had really bad, severe eczema. Now that Catherine is on allergy shots, she's improving, I mean, a lot. She's, not itching as much. She's, I can see that she feels better because before she used to have her face looks like she was sick because her eyes were red and they itch all the time. And not just her eczema, just the allergies, overall, she's doing so much better. So the shots definitely help her improve her allergies. The shots, they get used to them, and just to see how much better they feel, I think it's worth it. Just because, you can see that difference on their, personality, how they react, around people and stuff. The shots would help because we've been doing this since she was born, so none of this stuff helped her like the shots did. So.
Okay, my name is Khalil Muhammad Imara. I'm from Egypt. I came here in 1984. After I taken the allergy shot, I feel comfortable. Nothing bother me like short breath or runny nose or blocked nose. All of this is gone, it's disappeared. Before was severe allergy, honestly, but after the allergy, everything has changed to a good life, normal life. My life is different now. I can sleep at least 6 hours in night time. I can run 3 miles in half hours in the track. Before I couldn't even sometimes to play soccer or to do any activities with my kids or all of this. I think the shot is work fast and good. I recommend to take the shot because it's work very fast, better than any tablets in my knowledge. After I taken the allergy shot, I feel like different person, honestly. No severe, nothing, and everything is okay.
Hi, my name is Nancy Jett, and I'm 52 years old, and I've been taking allergy shots. It was a year this past February. Before I started taking allergy shots, I had all kinds of problems with allergies, sneezing, runny nose, fatigue, not sleeping good. After I started taking the allergy shots, it took about 6 months for me to really tell a difference that they were going to help. And I really can tell a difference with taking the shots. If I had not had started going there, that, I'd probably be worse off now than I was before. And I had bronchitis last year, and I haven't been sick at all so far this year. And since then that I've been taking allergy shots, I feel like 90% better.
My name is Freddy Kojima, and I have had a sinus problem, sinus infection, allergy problem for quite a long time. I was probably on antibiotics almost every 3 weeks, sometimes twice a month. And now, 4 years from that point, I'm getting sinus infection probably once in a couple months, and that was a great reduction in number of sinus infection. Just believe in what's going on, and that's probably give you a motivation to just keep going, and just doing it, and next time you know your allergy symptom may be less than before. But it's so gradual change, you cannot see changing overnight, but just keep doing it and it's gonna change.
I'm BT Peak and I'm 15 years old, and I just started allergy shots about 1.5 years ago. And once I started allergy shots, I was This year I didn't get any absences.